Hello everybody, welcome to Missimo Motivation. My name is Christopher Missimo. I'm a licensed therapist and I'm a strength and conditioning coach, and today we're going to talk about what anxiety really is. So stay tuned. Hey everybody, welcome. Today we're going to talk about what anxiety is. Now, I have to start off by saying that this one video cannot encapsulate anxiety as a whole, so we're going to keep it really general, and I'll probably do some follow-up videos on anxiety to help further explain it. But one of the things that I want to talk about today is, and you'll check this out right here. You see this bell curve right here? That bell curve? That's really important. Anxiety is, and listen carefully, normal. Anxiety is normal. Feeling anxiety is normal. Let me put it this way. If you went driving to work and you didn't feel anxious, or at least a little bit anxious, would you drive carefully or would you stare at your phone the whole time? You'd stare at your phone the whole time. You have to feel a little bit anxious during the day, which is the top of that bell curve. Again, we're going to keep this up right here. It's the top of that bell curve right there is a normal, healthy, functioning level of anxiety. So I want you to think of the y-axis as healthy functioning, like the right level of anxiety to be just focused enough without feeling paralyzed. And I want you to think of the x-axis as the level of anxiety. So as you get further down that x-axis, the level of anxiety goes up. Okay, so there is a sweet spot with anxiety to where it's actually really beneficial for you because you're aware that your next assignment is due. You're aware that that project at work is coming up. You're aware that you need to hit this out of the ballpark to be successful. And because of that, you actually go and do the work. So feeling anxious is okay. It's all right. It's not all right when it becomes a clinical issue. Okay? So here's the thing. Right here, I have what's called the DSM. This is what we use to diagnose. It's a 1,000-page book that we have to study and learn as a clinician. And I'm going to read to you what an anxiety disorder is just real quick, okay? Story time with Chris. Anxiety disorders include disorders that share features of excessive fear and anxiety and related behavior disturbances. Fear is the emotional response to real or perceived immediate threat, whereas anxiety is anticipation of a future threat. So fear is something immediate, like a panic attack. Anxiety is something future focused, okay? Another thing you need to understand is that anxiety disorders differ from developmentally normative, normal fear on our bell curve of anxiety by being excessive or persisting beyond developmentally appropriate periods. They differ from transient fear or anxiety, often stress-induced, by being persistent. For example, typically lasting 6 months or more. So I feel anxious because I have an interview tomorrow doesn't count. Although the criterion for duration is intended as a general guide with allowance for some degree of flexibility and is sometimes a shorter duration in children, since individuals with anxiety disorder typically overestimate the danger in situations they fear or avoid, the primary determination of whether the fear or anxiety is excessive or out of proportion is made by the clinician, taking cultural contextual factors into account. Last thing, many of the anxiety disorders develop in childhood and tend to persist if not treated. Most occur more frequently in females than in males at approximately a 2-to-1 ratio. So that is straight from the book. Straight from the book. Anxiety is normal, and it's no longer normal when it's been around for a long time or it's disproportionate to the thing that you should be feeling anxious about. And that's where there's this gap. There's this divide between what is clinically anxiety provoking and what is just normative anxiety, okay? So while I'm not going to break down the individual diagnoses in this video, I did want to read that to you straight from the Bible itself so that you would know that it's different, that there's a way that we go about diagnosing these. That there's a way that we go about differentiating what is anxiety and what is not. Another big key point, and this is where most people, I think, enter a greater level of awareness with anxiety. physiological symptoms are a very big component of most anxiety disorders. Rapid heart rate, difficulty breathing, sweaty palms and hands, nervousness, dizziness. There's different physiological increased resting heart rate, difficulty sleeping, like feeling on edge while you're trying to sleep. There's a lot of physiological signs, and those are the ones I think you really need to pay attention to. If I could say two things that I want my listeners or my viewers to think about is this clinical and something I should look at, or is this normative, are there physiological symptoms that you're experiencing, and does it cause impairment in social, occupational, or academic functioning? Boom, social, we're going to push it right here, social, academic, or occupational functioning. If it's not impairing you, it's not an anxiety disorder. That's really important. What I tell my clients is a problem is only a problem if it causes a problem. If it causes some type of impairment in your life, it's okay to feel anxious. I would love to do a follow-up video if there's any in particular that you think I need to cover. A lot of people think they have generalized anxiety disorder, and so I'd be happy to cover that one. And it's not that these things don't exist, guys. It's just I want to be really clear to you if you're watching this video trying to figure out whether you have a clinical diagnosis of anxiety or just like regular anxiety, does it cause one of those two things? That's the starting point. That's the starting line that I think people who are trying to gauge their anxiety need to begin with. And from there, contact a clinician. It's our job to be able to differentiate these things. We have psychological measures to do that as well. There's a lot of ways that we can go about doing that. So I hope that this was a general overview in a helpful way for anxiety. The last thing I will say, and I will wrap this up, is if you feel like you have this, you may also have a concurrent issue that is causing it. So if you're of that group that feels that you have the physiological symptoms, you have the impairment, you may actually have something else causing it. Anxiety and depression are often concurrently diagnosed, and being able to differentiate between which one is influencing the other bidirectionality wise is really, really important for treatment. So that's one last thing I would say about anxieties. If you feel you're in that group, think long and hard about if you're dealing with something else, because it may be manifesting the anxiety as well. So guys, I hope this was helpful. As always, please subscribe. Please comment if that was helpful for you. Let me know what you want me to talk about. This was actually voted on by my Patreon community. They wanted to hear something about anxiety. So big shout out to Dan. Big shout out to 8-Bit for being Patreon supporters and for voting on this video. I hope this was helpful for you. And guys, remember, mind, muscle, maximize.